Where every second counts and life hangs in the balance, he is there, calm and focused inside the ICU where pressure never drops. Meet the critical care nurse who stands in the gap between life and loss, one shift at a time. In honor of the role nurses play on this World Nurses Week, we take you inside one of the most extreme environments in healthcare, the intensive care unit at Kenyatta University Teaching, Referral and Research Hospital.
I'm Nicholas Orangi Matoke. Currently, I'm the nurse in charge of critical care unit here in Kenyatta University Teaching and Referral Hospital.
Nicholas is the calm at the center of the storm. As a critical care nurse, Nicholas balances skill, compassion, and precision every single day. From early morning handovers to life or death decisions, he leads a team working tirelessly to tip the scales towards life.
Day-to-day activities in critical care. First, I can say it is a chase with time, because every time counts and every second, every minute counts in ICU or in the critical care unit.
And the day starts early with critical coordination.
The first thing we do in the morning, we receive the handing over report from the previous shift, because our critical care units works 24/7. So it means we have it covered during the day and we have it covered during the night. So when we resume in the morning at 7 a.m., we take a report from those who are on night shift. There we do a quick safety check. In the ICU, we don't take any chance. We do safety checks to our machines because we are using a highly sophisticated machine to render care.
With lives hanging in the balance, every monitor, every ventilator and dialysis machine must be in perfect condition.
From there, we will do assessment to our patient, which is very important, whereby we're going to assess our patient from head to toe and know where we have where we need to work on and how we are going to plan our care. So doing our safety check is very important, because we're going to check all our machines are working and our teams are ready. In case we're going to have an emergency, then we have a prior preparation how we're going to handle an emergency, because in critical care, emergency is part of us and we are on course to respond to emergency. In ICU, when we are assessing, we assess from head to toe, but more we take in on systems. And these systems, we start from the central nervous system, which deals with the brain. Then we check on the cardiovascular, which checks with how our heart function or the patient heart function. Then from there, we go to the respiratory system. So from here, if a patient is having a cardiovascular problem and we've captured during assessment, we are going to give it a priority over something which is not of priority. For example, going and moving a patient from one point to another is not a priority, but fixing a patient who has a respiratory problem is of priority. And that's why it is very important for us to prioritize. With the kind of work which we do, we may get emotional at any time. So allow me to recall from the year 2020, when we had experience of COVID-19 in our country and also outside. It was a pandemic. I was among who were privileged to work in this ICU during the time for COVID. So I can say that time it was emotional, because we were overwhelmed and we had a huge volume of patients. You find that by then you were having so many patients and with added needs, especially those who had underlying conditions, and you are trying to give care and rendering your best. But some were not making it because of underlying condition, and those who were very sick at that time. So it was really emotional to us in the team, especially me. I was really down. But now the most important here was we had a good teamwork. Our teams were working very well in harmony, whereby when we were doing, even somebody can come and tell you that, hey, you need to fix something here because you've not done it. And that's how we managed the situation, and we took care of one another as staffs in critical care areas.
Involving patients in their care builds trust, and in critical care, that human connection is often just as vital as the machines.
For our patient, we normally do timely communication, and we let them know each and every procedure we are doing to their patient, and we ensure that in case of any change of condition for our patient, they're up to date. And we go to an extra mile to call them to come and be part of our treatment. So family and next of kin is very key in our management in the critical care areas. But we may have that case where the patient will not make it. So in that case, the patient will not make it. The family actually, they even appreciate us because we've taken them as part of the journey in the treatment for this patient. And that's how sometimes we find it very easy to break news in case we have a patient who died. For your information, we are at 90% recovery from ICU. So we are working to fix this 10.
Recovery in the ICU is hard-won, but it's the stories of hope that fuel Nicholas and his team.
I received a patient. It was a referral from a peripheral facility, and the patient, I remember, was from a malaria zone. The patient was referred here for treatment of malaria, and this patient also was expectant, meaning this patient was pregnant. So now this patient was down in a way that all systems started shutting down. We started with respiratory, then we went to kidneys, then now the patient was very critical. So at this point, with our state-of-art equipment and the sophisticated machines, I managed to do a CRRT for this patient. CRRT stands for continuous renal replacement therapy. Now in this continuous renal replacement therapy is whereby you're going to aid one of the failing organ, and here it was a kidney, because I remember this patient was given all other forms of treatment as far as malaria is concerned, but now we went an extra mile to wash her blood using our machines, and this patient was up within 48 hours, and we were targeting 72 hours in our treatment. So I was really very happy, because this was an expectant mother who was expecting to have a child. And even this, it was an interesting case because the patient, we de-escalated to the general maternity, and some few months, the mother delivered a bouncing baby boy like me.
In the chaos of critical care, moments of triumph stand tall. For Nicholas, every heartbeat saved is a reason to keep going. The pandemic tested their resolve, but the solidarity held them together both professionally and personally.
We had good support, and of course even now we have good support from our management, and specifically let me single out from our Director Nursing Service, Dr. Pamela Mgendi, who is like a mother to us, who responds to our concern and who goes to an extra mile to ensure that each and every nurse in KU Referral Hospital is well taken care of, and we have a way of working together.
His world is filled with alarms, urgency, and decisions that define destinies. In critical care, he saves, he comforts, and stands in the line every single day. For White Coat Diaries, my name is Yvonne Kawera.